So it says here that you can also see all of our past webinars online. Go to YouTube and search Smith & Jones Healthcare Marketing and see all of our past webinars, including this one. Hi, I'm Paul Fahey, Vice President of Smith & Jones. So our webinar is going to begin in a moment. In the meantime, I thought I'd just put in a quick word for us. So we're Smith & Jones, a healthcare marketing communications firm located in upstate New York. And we support hospitals, health systems, departments of health, really nationwide with a variety of campaigns including branding, service line, recruitment and retention, and even crisis PR. We'd love to chat with you after the webinar and even during the webinar. Raise your hand, put in a note. We'd love to hear from you. Our webinar will begin in a moment. Thanks.
Hi everyone, welcome to today's webinar. Today we are going to be diving into our brand new Healthcare Marketing Trends Report. If you haven't downloaded it yet, go ahead and head over to our website, smithandjones.com/ebooks/trends, and download your copy right now. But today we're going to be diving into all 5 of our trends and giving you an overview and a little bit more information about the report. So welcome. We're all going to get on the same page, which is the year of disruption. And like I said, this year we have 5 trends. And for everyone watching live, go ahead and use the chat to write in any questions or comments or conversations so we can address them live. And if you're watching this after the fact, you can always leave a comment or get in contact with us for any questions you have, and we'll be sure to follow up with you offline. So I'm going to throw it over to my friend Paul here to introduce this year's authors.
Thanks, Katie, for getting us rolling here. Yes, I'm just happy to hear representing not only myself and Katie, but Lisa Barone, our Vice President of Brand, and certainly a content and author of not only our Trends Report this year, co-authored our book, and a lot of the content that you folks see us as well. And a new face, our friend Jared Johnson, somebody we've gotten to know a lot over the last couple years. I'll describe the theme and what went into this year of disruption in a moment, and that'll make it pretty obvious why we had asked Jared to partner with us on not only the content, but also helping to comment and share some of his insights. Many of you know him from the Healthcare Wrap podcast, but also there's a monthly think tank that Jared hosts on consumerism, particularly in the healthcare space. Fascinating conversation. There's no sales pitches. It's just really a lot of folks getting together to talk about current events, trends, and really help understand this constantly changing landscape that we're working in. So we're happy to be working with him here. You can also hear an excerpt from today's webinar, also on this week's episode of his Healthcare Wrap Now podcast. So wherever you get your podcasts, Google Play, Apple Store, Healthcare Wrap, and take a listen to not only this week's, but a lot of fabulous content there as well.
Yes, thank you, Jared. So just to give you a little bit of background on our Trends Report, this is actually our 11th annual report, and the goal is really just to combine all the things that we're thinking about going into the new year, and it's meant to have lots of actionable tips and takeaways that really any size team or any size organization can start implementing to put the right foot forward going into the new year and hopefully stay ahead of your competitors. And the information from the report is gathered pretty much throughout the whole year from surveys, interviews, A lot of great information from Shushmed and Neshco, the conferences and their webinars and informational things that they put out throughout the year. Also social listening, Google Trends.
And MashMed too. Our good friends in
MashMed, shout
Middlebury.
out. And basically just everything that we're hearing throughout the year from our clients of what their biggest challenges are going into the new year. So here we are in the year of disruption. So Paul, how about we talk a little bit about how we got to this topic for the year and the situation that we're in?
Yeah, thanks, Katie. So as Katie just mentioned, this report is something we produce every year. This is our 11th year. And it's really kind of a summary of all those things we're hearing and seeing that we're presenting about, that we're reading about. And we use it as an opportunity to kind of all roll it up into what we see as the most influential, important, trends that healthcare marketers really need to be paying attention to. We typically plan this in the spring. If you're watching live now, this is the end of September 2023. So in the course of that and our work over the summer, we started looking and saying to ourselves, okay, how does this all, what are the common threads and what's really happening? And I think the trends that we'll walk you through today are not new to most of us. I think some of us have heard them, depending on where you are geographically. And I know that there's a diverse group that's represented that's watching live now. So good morning to those of you on the West Coast. Good afternoon to those of you that are here. The regions that you're in are also seeing different plays by some of what these are, these disruptors are. And I think that's a lot of what went into that theme. The acceleration of consumerism, the changes in the pace of everything else. Again, it's probably a lot of the things that we are all reading about. We tend to go to the same conferences, we read Becker's, we listen to the Healthcare Wrap podcast. There's a lot of stuff that we all pay attention to. But for us, it was an opportunity to not only aggregate all this, but also look at that one common theme that said, boy, 2024 is really where a lot of these things are going to be completely entrenched. Things that have been sort of in and around the fringes are going to be all in within our communities. And we see that, quite frankly, as disruption to our normal approach to healthcare marketing. So that's what went into the theme of that. A lot of this is changes in consumer behavior post-COVID. There's a lot happening with retailers and all the things you'll hear about in the next few minutes.
Yeah, and we've been talking about consumerism for a while now, right? But I feel like after COVID, it's really just pushed everyone's hand and really pushed forward that you can't go back to business as usual. Like, these things are being expected now and demanded, and they kind of have to change. So that's why it's all being pushed forward now.
And since this is the fall of 2023, Katie, let me just remind folks, you referenced COVID. Recently, there was a pandemic of a global nature. In case you forgot. Yeah. But in all seriousness, walk into your local Walgreens, CVS, try to find a COVID test or a set of masks. It's kind of difficult. And maybe you're hearing about somebody here or there, and there might be pockets. You might have communities that have some flare-ups. But it's pretty remarkable of what we lived through from 2020, on through, and perhaps, we could also declare pandemic over, but here we are ramping up into COVID and flu season again. But it's pretty remarkable that this had such a tremendous impact on our society and yet seems relatively invisible right now. Okay. So part of that, and to Katie's point a moment ago, we believe that COVID had helped to accelerate this consumerism. And we talked about this a bit last year for those of you that remember not only last year's trends report, but also last year's webinar. Who are these new patients? And you'll hear a lot about them in our first and second trends. But what's really changed, and I'm old enough to remember that first initial salvo with WebMD, and that was the first shift of knowledge away from the revered physicians who were only able to share the knowledge because of their direct patient interaction. It was only through WebMD where you could type in symptoms, you could go in armed with a potential diagnosis. And some physicians felt threatened by that, some embraced it, but it really was that first opportunity. And what we've seen through all of the things you'll hear about in the next few minutes has really given rise to that new patient model. They're shopping online. They're looking for quality indicators. They're looking and paying attention to Google reviews and Yelp more than they are, health grades in U.S. News and World Report. They're relying less on clinical references and recommendations, and they're actually reaching out to not only their personal networks, but their social networks. We're seeing people crowdsourcing, hey, I'm looking for thus and such or whatever. They're looking for and really embracing alternatives to traditional in-hospital care. These hospital-at-home models are accelerating tremendously in a number of markets, and all of that is meeting people where they're at or where they want to be, frankly. The rise of high-deductible health insurance plans has given consumers a little bit more buying power. They love Walmart Health's rate cards and can see exactly what does a strep throat screening cost and what could this cost. They would know before they even walk in what to expect by what they might ask for. So this idea that they're shopping with, and being more cost conscious is something we haven't seen, certainly it's accelerated over the last couple of years, but it's not something we've seen in the past. And care and convenience. Again, many of you on the West Coast are familiar with these urgent care models, bringing the ER to your home in many cases, or urgent care services to your home. Why would I want to wait in your waiting room for several hours, surrounded by people, so that my injury can be compounded by your infectious disease, with my fellow patients, when I could rest in the comfort of my own home? Your mobile vans can arrive at my home, take my x-ray, and determine whether I have a sprain, a break, and help treat me from there in those cases. Again, all of this is pushing and giving rise to our first trend, which is that, I think, right? It is, yes, it's our next slide. That acceleration of patient empowerment and consumerism. And as I mentioned, this is quite frankly, the theme of Jared's think tank, but really, truly remarkable how empowered the consumer is. I remember being at a healthcare conference, the Hospital Association of New York State, Haney's, 2004, and we had started to put out and started to develop personas for the different types of patients. And on one end, you had the fix-me's, the people that said, you went to medical school, I didn't. You just tell me what's wrong, I'll follow your lead. And at the time, and this was relevant then, for those of you that will remember Murphy Brown's character on TV, Candice Bergen, she was very strong-willed, very empowered, was really going to make decisions based on the information she gathered, because I think she was a reporter, but she was a very take charge, in control personality. And that was at the other end of the spectrum. Folks are shifting into that like never before. And that was even a model, or at least a persona, that existed 20, 30 years ago. But now, as we were mentioning, this access to information that people have is overwhelming, beyond WebMD, the apps and everything else. The wearable technology, we've got it, hey. Can allow me to track my health. I had an opportunity, a very unique opportunity, about 7 or 8 years ago to meet Steve Wozniak, co-founder of Apple. And I had said to him, what do you see as the future? This is several years into the iPhone and iPad revolution and everything else. And he basically said, this device will help enhance the quality of your life beyond what it does for its mere telecommunications convenience. But it's going to be able to track and help understand, recognize symptoms, heart attacks, and really communicate not only your fitness and health beyond that. The online communities that we talked about a moment ago are tremendous, and those can be formal, gated communities on Facebook, organized by maybe your local hospital or health system. But people want to be surrounded by other people that they can learn from and help them navigate what is a very complicated, system, these healthcare systems that we have in the United States. The health apps that we've got on screen here are tremendous. They can help guide you to a set of goals. They can communicate, they can interact with you, and all of that, rolling up to a very personalized sense of medicine. We're even seeing that in some of the innovations within hospital ERPs, the integration with some of these apps. And it's truly remarkable. What I think is really interesting is it mirrors what's happening in other aspects of people's lives. If you're a sports fan, there's an equal ecosystem of things that could be within your hobbies, the apps and the communities and everything else. But it's that sense that what I enjoy and I expect in other aspects of my life, whether it's retail shopping, hobbies and entertainment, anything else like that, I'm asking for and almost demanding in my healthcare experience.
Absolutely. Let's go consumerism.
Oh yeah, right. So I'm still on me. That said, and it's sort of given rise to this commoditization, and I think this is where things get a little bit complicated for us as healthcare providers. We want to build brands. We want to be a destination of choice. We want to be a provider of choice. But as I was mentioning, all of these things are helping to fuel that commoditization. Now, this varies based on demographic and persona. Younger families, younger healthcare consumers tend to be more mobile. Seniors tend to make decisions based on proximity and convenience. But all those things I described before, demand for price transparency, the reviews, the retail clinics that we've been talking about. If you follow us, you've attended some of those webinars where we're talking about that march northward that Walmart Health is making and Amazon Health across the country. The integration of healthcare providers within your community grocers, all of them are competing for that access and convenience. To Katie's point, the acceleration post-COVID really cemented telehealth and telecommunications, especially for rural communities. We got more comfortable being on Zoom, and the rise of doctors on demand, medical health professionals that you can just tap into for 20-minute quick visits, all online, is tremendous, and something, frankly, that didn't exist several years ago. And Katie, mention for us a little bit about medical tourism. What's happening there?
Yeah, I wanted to mention this because I think it's such an extreme example of healthcare consumerism that in some cases it can actually be cheaper to fly out of the country, go to a different country to get a medical procedure done. Like, it would be cheaper for you to pay for that out of pocket rather than having to go through your insurance. It would still be cheaper, which is just a completely wild concept. And I don't know what the solution to this phenomenon is, but it is something to keep in mind that people are getting really crafty with how they're going to seek care and what they're willing to do to get the care that they need. So.
Yeah, and we saw this 20 years ago with pharmaceuticals. As pharmaceutical costs went up, there were busloads of seniors that were crossing the U.S.-Canadian border to go north for pharmaceuticals that they could get and bring back. That gave rise to a really fascinating PR case study of counterfeit pharmaceuticals, of which there was never an example. Read about that some other time.
All right. Trend number 2, the role of the patient journey in brand perception.
So in trend number 1, we've sort of set up and cemented this idea of the empowered consumer. That said, this consumer is breaking beyond those boundaries that we had in that cat and mouse game that we played as marketers and advertisers to consumers. They're going to see through very contrived ad campaigns and claims of quality and experience. And in fact, the patient's journey is something that I think every healthcare marketer watching this should audit. And that can be a very formal or it could be a very informal process depending on what your resources are like. But the example I gave when I was on Jared's Healthcare Wrap podcast this week was the analogy we always use is the airline tray table analogy. So imagine you're at 36,000 feet, you've leveled off, it's time, they're gonna roll up the drink cart, up the aisle, have a snack. So you flip down that tray in front of you. And it's dirty, or it's loose, it's kind of wobbly or whatever. You may not make a direct correlation between that, but what tends to happen, and we've done some research into this, the passenger on that flight says to themselves at 36,000 feet, that's a pretty simple thing to maintain. If you can't handle keeping the tray table clean or just tightening up the bolts on that, how are you doing on that engine out on the wing there? And that's frankly not something that you want to think about at that altitude. With that analogy in mind, think about that patient journey through your entire healthcare system. From that initial inquiry, and it may start with advertising. You may sensitize them to your brand. They may start to be curious about you. Now they have a set of symptoms or a direct need. And so what is that journey like? Perhaps it begins at your website. Maybe it converts into a phone call. They arrive at your physical plant. What are those staff interactions like? All of that entire process through, and this goes beyond just hanging a nice poster in the waiting room or putting in some fresh plants, but every touch point of that experience is more so now than ever before going to be a mark for or against you as an organization. When we go into focus groups with healthcare consumers, forever, for the last 20, 30 years that we've been doing this, we sit down with them, we ask them what matters. You know, when they think about one hospital or health system and they compare it to another, what's it on the basis of? And it's all, increasingly so, these types of either experiences on their journey or those customer service aspects. I actually have to probe and say, what about the best doctors, the latest technology? And for many patients, that's the cost of doing business. You better have that. In fact, I assume you have that. Why did you ask me about it? If do you not have it? And so it's these little things. Do you have valet parking? Is there a Starbucks in the lobby? You know, all of those types of things are shaping that experience and creating brand loyalty more so than ever before. So audit your organization. Kind of go through from initial inquiry, you know, all the way through even to ask about what that billing and you know, post-operative discharge, you know, rehab process is like. And ask yourself, do you need the employee training? You know, what kind of feedback can you get? But more importantly, understand, you know, is there a disconnect between your marketing promises and your operational reality?
Yeah. I know at one point we were working on a campaign where, like, the hospital ended up deciding that they couldn't live up to the promises. And even though that's really unfortunate from a marketing perspective, it is important that to not put claims out there that you can't live up to, because then that's just going to make the person even more upset if it's not living up to what their expectations are. And there was some great presentations at ShushMed if you got to go, or there's also the virtual conference that's coming up where you can watch the recordings, where they had a lot of talks about how to audit your entire patient experience and that all the different needs that these patients are going through. So definitely go ahead and check out their resources too.
So Katie, that brings us to trend number 3.
Yes.
When you think about all of that consumerism that we talked about, you know, their role in that journey, it kind of gives rise to how do these folks want us to be speaking to them? So take us through trend number 3.
Yeah, so patient-centered or plain language, they can be used interchangeably. It's basically about making sure that your information, whether it's, you know, in a flyer, a brochure, or most importantly on your website, that it can help people find what they're looking for, understand what they find, and be able to use that to act. So, and basically it's just explaining things in the most simple way so that anyone can understand them. So yeah, let's see. Yeah, so, sorry.
And while you're gathering that thought,
Yeah.
I think one tool that we like to use, it's free, it's open to anybody, but Hemingway.com, the author's name, Hemingway.com, you can paste a link, you can paste in copy, and it'll actually give you not only feedback on grammar and punctuation and things like that, but it'll also tell you whether you're writing at the 5th and 6th grade level, where you should be for most things, or is something postdoctorate level, you know. And to Katie's point, you know, how that plain language comes in, you know, that conversational but confident tone tends to be what consumers want.
Yeah. So it's really about, so the reason why this is so important now, it's always been important, but consumers have more choices now, right? So if they show up at your website and they can't understand what you're saying, or it's confusing or clunky, they don't know what they're supposed to do, they're just going to leave and they're going to try to find someone else that can help them. So you want to make it easy for them to understand exactly what's going on with their health and how you can help them and what the next step is. So if you were at this year's NESHCO conference, you got to hear the great keynote from our friend Ahava Leibtag on patient-centered language, and how, like, she explains how when people are in really emotional situations, it makes it even harder to understand complex health information. So even if people think that they are health literate and generally think that they can understand things, when you're in a highly emotional and stressful situation like a health crisis, it's just so hard to understand and to think about things, in a logical way. So that's another reason why it's really important to make things as easy to understand as possible. And definitely cut out as much jargon as you can, as much long and complicated words. We have some great tips that you can use in the Trends Report, so definitely check out that. And just the stat that 9 out of 10 adults have difficulty understanding health information. I mean, 90% of the population, that's huge. So definitely audit your content, make sure you're using the best practices that are outlined in the report, such as using headings, bullets, making sure your content is skimmable, and that you're starting with questions and answering those questions. So yeah, that's what we have on patient-centered language. So next up, we couldn't get through a 2024 report without talking about AI, right? So from a marketing perspective, it's totally okay to start experimenting with tools like ChatGPT and Bard, but I feel that in healthcare marketing, we should remain a little wary because this is healthcare. One of the webinars that I've watched with healthcare marketers talking about AI is just that, healthcare has more responsibility to do no harm and to not put out any information that could be potentially incorrect. And these tools, they are not perfect. They are not creating information. They're pulling information from the internet. And the internet is not perfect. As we have seen, the internet has a lot of troubling things out there. So it's very possible that when you put something in, it's going to output something that's either problematic or just straight up false. So anything that you're using it for, just remember to take it with a grain of salt.
Yeah, and just building on that for a second, Katie, the term for that is hallucination, when ChatGPT kind of gets it wrong or whatever. So there's a few different ways that we've seen people using it. Ourselves as marketers, it can be a great time saver, and I'm stealing Katie's thunder here. We'll talk about that in terms of the efficiencies, and it takes you from that blank sheet of paper into someplace else. But to Katie's point, it's pulling in from imperfect data, so you should always pause to see what's happening. The really fascinating thing, and the other aspect of AI for healthcare marketers, is beyond your patient login, but actually the integration. And we've seen some really fascinating presentations, some beta testing that's being done with Epic, for instance, interfacing with hospital ERPs and putting AI directly in between that. So patient logs in, they're beyond the firewall, they're now interested in having a conversation, a secure conversation with their healthcare provider. So to Katie's point, the ChatGPT that we all use is just pulling from stuff that who knows where it is. What's happening here, and where I find this absolutely fascinating, is it's interacting not only with the physician and helping them craft the responses, maybe with a little bedside manner, we really kind of like this, but it's also interacting with the medical records for the patient. And that data is pretty accurate. All it has to do is have a quality interface between the prompt, the question I'm asking my physician, and the answer that might be in my medical records. So imagine if you're a patient logging in and you, hey doc, it's Paul, following up on our conversation last week when I saw you in your office. I'm 3 or 4 days into the medication. Is it common for me to have this side effect? It'll actually look up my records. It'll actually make that determination. It knows all the data, the answers. It formulates a response, and even packages that, again, with that bedside manner physicians don't always have time to do. Hey, Paul, thanks for reaching out. Hope you're doing well. Thanks for calling. So I looked everything up based on your medication and what I know about you, that symptom or side effect, blah, blah, blah. Hope you're having a great day. Call my office if you have any questions or whatever. But to Katie's point, it pauses. It recognizes that it's not perfect yet. So I'm going to let the physician review this draft. Okay, the physician now can merely go in and say, my patient asked this question. This is the answer. Yep. Looks good to me, hit send. An amazing time saver. And I think that goes to Katie's next point about how to be able to use this tool more effectively.
Yeah, I think as long as you have that human review step, this is really promising. I think this would really help both sides, the patient and the doctor, but having that human review step is the most important part. But yeah, generally, we're thinking that you should use AI on your back end to kind of help you come up with content ideas or research, or help you edit the content you already have, but you definitely don't want to be using it to write a blog or something like that. Like I said, trust is everything, so you don't want to put anything out that could potentially be inaccurate and hurt your reputation. Another interesting part of this is you might want to start putting together an AI code of conduct, which are essentially guidelines for your organization of how you want to be using or want not to be using AI. I know for our organization, we're thinking about putting this together for our staff. And there's also Shushmid, they talked about the National Academy of Medicine is actually putting together a code of conduct now that they're working on. So that's going to be something really interesting to keep an eye on. How is the community approaching this?
Yeah, it's interesting to think of it. When we were at SHISHMED, I heard somebody basically use the example and said, yes, I could do long division by hand with a pencil, and it's just going to take me a lot longer. I'm going to perhaps arrive at the same conclusion. But I choose to use a calculator because it performs some of those functions. So I don't think it's going to replace some of what we as marketers are doing in terms of crafting content. Perhaps it can get us up to speed a little bit faster and then allow us to add in the customizations and something. But to Katie's point, it's evolving. It's part of what's disrupting the work that we're doing. It's part of the reason that it's in our trends report this year. Mm-hmm. Couldn't have it in there without it.
Oh, and one other thing I'll say is I know a lot of people think if they haven't started using AI yet that you're like behind the ball, but a lot of people that I've heard speak is that, this is still very much new and trending, so you're not behind the ball if you haven't started it. But so it's all happening.
And disrupting.
Yes. Okay, workforce challenges.
That's here to stay. Sorry. You've seen us do a number of different webinars and blogs and presentations on this. It's certainly one of those things that's going to continue to disrupt our business. And I think what we've seen over the last couple of years is frankly a shift in marketing budgets away from service line advertising into recruitment, getting those departments. And some of you saw us present at HITMIC on this. But that idea that your marketing and HR departments should be working a lot closer together, sharing resources. And I think what we've seen over the last couple of years, is the strain that that's putting on the organization's bottom line. If I don't have the healthcare providers, I can't see the patients. If I can't see the patients, I can't earn revenue that's going to allow us to stay open. So that's accelerating, a lot of closures. And again, it's taking us away from the business we want to be doing, which is taking care of our patients, and forcing us to try to, really work aggressively to build that workforce. We're guilty of poaching as much as anybody else is. I think, it's a zero-sum game. And so, over the last decades, we've been, all right, I'll take your nurses away and hope that I can keep them and build a better culture and that kind of thing. But I think there's opportunities, and what we talk about in this trend is the opportunities to build more sustainable pipelines and pathways for this. Certainly we all have the feeder schools that we want to send us their best and brightest, but I'm talking about even some really, really innovative examples. So we're in New York's capital region. Ellis Medicine is a client of ours, and about 6 months ago, boldly went out with what they called the Ellis Promise. They went to the residents of Schenectady and basically said, if you are a graduate of Schenectady High School and or Schenectady County Community College, we promise you that you'll have a job within our community. And it's one of those things that the community wants and needs, that kind of commitment. They want organizations that are going to embrace the workforce that's coming out at whatever level, at whatever, set of interests folks might have. This goes beyond clinical. It could be IT, it could be HR, it could be operations, landscaping, any of those types of things. But it's been really, really well received by the community, and we're really looking forward to probably early 2024 reporting out on early metrics on it. But we see that as a fabulous example of going deeper than just, the "we're hiring ads, please." Going deeper than just "we're trying to take your people away from your community," with, the arms race of incentives and bonuses and sign-on bonuses and things like that, but into building more deep, sustainable solutions. And I think the other thing that we have been seeing is a shift in that messaging, again, going deeper than the "we're hiring" headlines into pushing out the nobility of this profession. Yes, late nights, long hours, there is a lot of burnout that can happen. Stay the course on the programs that you have that are helping that work-life balance so folks can rest and recharge. But at the end of the day, we're on the side of angels. You are. We're not. We're marketers. We're doing work to keep our communities healthy, and that is a very noble profession. It's also something that's in demand. I think folks remind me early on in 2020 when we started looking at the early days of the pandemic and what dramatic shift that had on our economy. Essentially, we shut down our economy for the first time ever. And the non-essential industries, restaurants, travel and tourism, hospitality, all of that got kicked to the curb very quickly. And I thought, wow, this is a watershed moment. This is the 9/11 moment for hospitals and nurses. Folks are going to want to shift into more essential careers. They didn't flock to it the way that I was expecting over the last couple of years, but I still think there are deeper and more sustainable solutions like we cover here that are also in our trends report. And I think we'll also be taking a much deeper dive on this. As you know, we tend to split up all of these trends into webinars. So in the coming months, we'll talk more about these and look forward to sharing some of the results on some of those solutions.
Yeah, and so the demands of nurses and doctors and staff that we need, it's just not enough. So poaching, there's still not going to be enough. So it needs to be those long-term solutions of reaching out to kids, maybe even super young, right? Throughout high school and college, and building a career that these kids will want to have. And I also wanted to shout out my alma mater, SUNY Oneonta. Oneonta and Hartwick, which are both in Oneonta, New York, actually just created a program together. So a student can come in and do 2 years at SUCO and then transfer to Hartwick to complete their Bachelor of Science in Nursing. So they saw the need to be training more nurses and to give students that opportunity where you can do 2 years at a state school, it'd be a lot cheaper, and then transfer seamlessly right into Hartwick to get your Bachelor of Science in Nursing. So I just thought that was a good example of the community and two colleges recognizing this need and coming together to come up with these solutions. So any healthcare organization, you should be talking to your local colleges, community colleges, university, and high schools, and just coming up with solutions of how to move this forward. Okay, off my soapbox.
And that brings us to the end.
Thank you. So yes, please feel free to drop in the chat any questions, comments, or concerns. And like I said, go ahead and download the full report now. If you do want a fabulous printed version, just go ahead and get in contact with us, and we'd be happy to send along some printed versions to your organization. And make sure that you're subscribed to our emails, and we'll be emailing you throughout the year to let you know about new webinars and blogs and other resources coming out of this trends report.
Yeah, thank you for joining us. Thanks for spending time with us during your lunch break today, and for those of you watching this on demand, for spending time. As Katie said, we're going to take a deeper dive. As you know, we tend to take each of these trends and turn that into a monthly webinar, just focusing on that one topic in a lot more detail. So there's more in the printed version that we can share now. There's more that we look forward to sharing in the coming months. Before we wrap up, always want to give a shout out to our studio engineer, Dave Parker, but in particular, welcome Jacqueline, joining us from RPI with a particular technical and creative interest in all things audio. So thank you guys for making us look good and sound good today, because otherwise, we'd just be talking to the wall, right?
Thank you, everyone. Have a great rest of your day.